You're all set.
Hi, good morning. My name is Jasmine Dew. I'm a registered nurse at Aventura Hospital and Medical Center. And this morning I'm going to be talking about sepsis. What is sepsis, ways to prevent sepsis, and how it's treated. Can everyone hear me well and see me well?
Yes, we can.
Okay, awesome. So the first thing that I want to talk about is what is sepsis. So sepsis is your body's, it's a toxic response to an infection. So instead of your body fighting off an infection, it actually turns on itself, if you will. It's one of the major killers in the United States. It kills more than 250,000 people every year. And it's actually one of the #1 killers, silent killers in the US. It's sort of similar to how hypertension is always said to be a silent killer because sometimes you don't always recognize the signs and symptoms. Same kind of goes with sepsis. So 87% of sepsis cases begin in the community, not in a hospital. So what that says is that we have to do a really good job of recognizing sepsis and knowing when is the appropriate time to seek treatment. So sepsis, now what does sepsis do and who does it affect? So sepsis disproportionately affects older adults. And usually when older adults get sepsis, they actually go into shock. And we're going to talk a little bit later about what the differences are between severe sepsis, septic shock, and sepsis. Older patients who have sepsis usually have a higher risk of having long-term cognitive impairment and physical problems. And we'll talk a little bit more about that later. And also, they're more likely not to be able to return home or to their previous living conditions. So these patients, sometimes by the time they get to the hospital, sometimes they're so sick that they're not even able to go home. They end up going to a rehab or a long-term care facility, something like that. Excuse me. So one of the things that I usually try to do with my presentation is make it a little interactive, and I know that's kind of hard to do when we're on Zoom. But I like to ask a few questions, and I'm going to ask whoever's listening to just kind of write these down and think about them. And then at the end of the presentation, we'll see who could guess some of the answers to these questions. That's okay with everyone. I'm gonna go ahead and start that. So the first thing that I would wanna ask is, what is sepsis? So we kind of just went over that briefly. And there's 4 choices. Choose and let me know which one you think at the end. So is it A, an infection in the blood? A local infection such as cellulitis or an appendicitis or UTI? Is it a toxic reaction to an infection or a chronic disease? So just write it down. You don't have to answer right now. Just kind of give you something to think about throughout the presentation. Is sepsis contagious? True or false? Who is at high risk for developing sepsis? Newborn babies, pregnant women, people with cancer, or people over 65 years and older, or all of the above. Which type of infection can lead to sepsis? Bacterial, viral, fungal, parasitic, or all of the above? Okay, I have another question. When someone has severe sepsis or sepsis, their chances of survival drop by as much as 8% for every minute, hour, day. So think about that one. Sepsis is more deadly than, give you 3 choices, you choose the best one that you think. More deadly than breast cancer, AIDS, or prostate cancer. really quickly through this part. So there's certain things that people associate with sepsis. So the one thing that sepsis is not, and it can get confusing, is sepsis is not blood poisoning. Sepsis is not an infection. Sepsis is not contagious. Sepsis is not rare. Okay, so I'm giving you some of the answers to these questions to see how many of you are paying attention. And another thing, there's not a lot of people who have heard about sepsis. They don't know what sepsis is. They've never heard it before. And the reason for that is that doctors, we tend not to use the word sepsis. We tend to use other words like infection, shock, but very rarely do we actually use the word sepsis. So what I want you all to start thinking about, and at least in the community and spreading the word, is actually using the word sepsis so that people get used to hearing it. Just like we know what stroke is, everyone knows what stroke is. We've heard it 1,000 times, but not a lot of times do we ever hear the word sepsis. Unless we've been in a hospital, we know someone who has, and they've actually had sepsis and they've been diagnosed, we usually do not hear the word sepsis. So one of the things that we want to talk about is how to identify sepsis. So what are the signs and symptoms of sepsis? So we've already talked about what sepsis is and what it's not. Now, and what causes sepsis is a toxic reaction to an infection. So how do we know when our body is starting to have a toxic reaction to an infection? So we have an acronym. I'm not able to share my screen, but it's called TIME. And it looks like this. You can all see this, okay? And TIME stands for temperature, infection, mental decline, and extremely ill. So if you take nothing else from this lecture, remember that acronym, it's TIME. And when we talk about temperature, we talk about higher or lower than normal, okay? Infection. So if you have any signs and symptoms of an infection. So if you're having any burning or urgency when you're using the bathroom, you could have a UTI. If you're having any pain in your abdomen, that could be a sign of an infection. It could be a GI infection. It could be cholecystitis. It could be an obstruction of some sort, which could lead to an infection. If you're a dialysis patient, you have a catheter, you have a fistula for your dialysis, you have to pay attention to any warmth, any redness, any signs of any kind of discharge coming from that area. If you have a wound, same thing. Okay, so paying attention to the signs and symptoms of an infection are very important. So the M, which is for mental decline, confused, sleepy, difficult to arouse if you're taking care of a family member who's a little older, who already has some kind of underlying condition. Pay attention to whether they're off from their baseline, okay? If they're confused, but they're even more confused today, or they're, very, very sleepy and, just don't want to do anything. Same thing for your children. If they're just, they can have a cold, but if they're just difficult to arouse, not wanting to engage in any activities, that's something that you want to pay attention to. And the E stands for extremely ill. So I just don't feel well. We get that a lot in the hospital where you cannot necessarily identify what's happening with the patient, but they just don't feel well. So that could just be a general feeling of I don't feel well, or I feel like I might die, or I'm just having severe pain. I just can't get comfortable. All of those things you want to pay attention to. Okay, so remember that acronym, TIME: temperature, infection, mental decline, and extremely ill, a feeling of extremely ill. Okay, so what the other important thing that we want to also stress to the community is that sepsis is a medical emergency. Okay, if you or your loved one has sepsis, the chances of survival drop as much as 8% for every hour treatment is delayed. Okay, so what do we want you to do? Call 911. Tell the operator, I think I may have sepsis. Use the word sepsis. It's not a bad word to use. If you think you may have it, just like if you're having chest pain, you can say, I think I'm having a heart attack. It's the same thing with sepsis. We want people to start getting used to hearing it and knowing what it is and knowing when it's time to seek medical treatment. So again, we talked about sepsis being a toxic response to an infection. Now, sepsis occurs when your body starts to attack itself rather than the infection. You must have an infection to have sepsis, but the type of infection is not always identified. So that's the key, is that to have sepsis, there has to be an underlying infection, because you can have an elevated temperature, you can have mental decline, or just not feeling well. It doesn't mean you have sepsis. But if you have an infection, or you have a sign or symptom of some type of infection associated with those other things, then the likelihood of you having sepsis is very high. Okay, so the types of infections that can lead to sepsis, let's talk about that. So bacterial infections are the most common type of infection that can lead to sepsis. It can be spread many ways and usually results in illnesses like a urinary tract infection, MRSA, or a bacterial pneumonia. So there are different types of pneumonias. There's a bacterial and there's a viral pneumonia. Viruses can also lead to sepsis. They can be spread by touch, bodily fluid exchange, in the air, and they include illnesses such as the flu and a viral pneumonia. Okay? Fungal infections most often appear on the skin, but they can be caused by inhalation of spores into the lungs or an injection into the body. So you want to pay attention to anything rashes on your skin. And a parasitic infection such as malaria, which is often spread by mosquitoes. So that's 4 different types of infections that can lead to sepsis: bacterial, viral, fungal, and parasitic. So how do we go from having an infection to now having sepsis? So there's a continuum of the disease process that we call infection with SIRS, we call it. There's a specific criteria that, okay, I have an infection and now my body is starting to react to this infection in a bad way, and I'm progressing from just infection to now sepsis, to even further down the continuum into the disease process, which is septic shock. Okay, our goal in encouraging you to get to the hospital and seek medical treatment early is to prevent you from going from an infection to sepsis into septic shock. By the time you get to septic shock, the chances of survival are very, very low. And again, it's really important that once you recognize the signs and symptoms of sepsis, that you seek medical treatment immediately or as soon as possible. Septic shock is a severe and potentially fatal condition. It can cause life-threatening low blood pressure and is very, very difficult to treat. If you wait until you're in septic shock to seek treatment at the hospital, again, you're already so far into the disease process that the likelihood of survival is very, very low. Now, if you're someone that has underlying condition, like a chronic illness, diabetes, COPD, if you've had sepsis before, a dialysis patient, you're very, very young or very, very old, or anyone with a weakened immune system. Again, if you have these signs and symptoms of sepsis and you are already susceptible because of that criteria, you definitely need to get to the hospital as soon as possible. So the treatment for sepsis is very, very simple. Honestly, it's not something that's extremely complicated. We encourage you to come to the hospital as soon as possible. If you feel like you have signs and symptoms of sepsis, when you arrive to the emergency department, we're going to do some quick labs, get you some vital signs. We're going to get you fluids, antibiotics. Those are the 2 most important things, the crucial things that we're going to give you in the emergency room to treat and combat sepsis. Fluids, antibiotics. That's the treatment. It sounds simple, but if you wait too long, now we have to start going into other medications to treat your blood pressure and to treat your heart rate and things like that. But for the infection and for the sepsis, really the only treatment that we give, antibiotics, fluids, and we do run some additional labs just to check to see the source of the infection or type of infection. Now, ways to prevent an infection. Again, I know we've all been hearing this on the news about hand washing, how important it is. The number 1 thing to prevent an infection is hand washing. Okay, 20 minutes, warm water, soap and water is the best. Hand sanitizer will work, but the best way to prevent infection is hand washing. That's number 1. Number 2, if you have any open wounds, we want to make sure that you're taking really good care of those wounds, doing your dressing change. If you've been instructed by the nurse or the physician, and if you've been in a hospital or you're at home, making sure that you're paying attention to that wound, any redness, any discharge, anything like that, you want to definitely contact your physician, your primary care physician, or just go to the emergency room. And if you have been prescribed antibiotics, this is very important. You want to make sure you take them as prescribed and finish them. I know a lot of times we get antibiotics for, say, UTI, or, you know, for a respiratory tract infection, something like that, and we feel better, and then we stop taking our antibiotic. But when you do that, it actually can cause more resistance to antibiotics in the future. So if you've ever been prescribed an antibiotic, or you're prescribed one in the future, it's best that you continue to take it as prescribed and finish. And stay up to date with vaccinations. That's also important, because that can prevent you from getting the infection in the first place. And we're almost done. So again, what can you do to, you know, advocate? What can you do as a citizen, as someone in the community, to spread the word and make people aware of sepsis? You want to know the signs and symptoms, which we've talked about. Remember the acronym TIME. Use the word sepsis. It's okay to talk about it. It's okay to acknowledge that it exists, and to make sure that other people are aware that this is a potential life-threatening emergency, and that you need to seek medical treatment. You want to also express your concern to the medical team. Sepsis can be confused with other things. So it's important that if you feel, you know, that you may have some concerns for sepsis, that you voice those concerns to your medical team, and also kind of let them know, okay, you're educated, you're aware of what's happening with you and what's happening with your body. And if you don't understand what the doctors or the nurses are saying once you come to the emergency room, or if you're in the hospital, then ask questions, ask for clarification. A lot of times I have my patients that have medications, they don't know what they're on or why they're on it. You know, you're getting antibiotics and fluids when you get to the emergency room, and you really don't know why. So you want to always ask questions, ask for clarification, and you want to know why you're receiving the treatment that you're receiving. Okay, so I'm pretty much done. I just have one more thing that I wanted to kind of point out. And this is, we talked about the elderly population or the adult population. Children can also get sepsis, especially a child who's under 5. Now, if you have a child who's feeling abnormally cold to touch, looks mottled or bluish, has pale skin, has a rash that doesn't fade, when you press that rash and it doesn't go away, breathing very fast, is having a seizure, just very difficult to arouse, you want to make sure that you seek medical treatment immediately. Okay, it is a medical emergency. You do not want to wait. It's not just a regular cold. This is a medical emergency, and you need to seek medical treatment. Okay. So, does anyone have any questions?
I just remembered you saying about the time. So that would help me. Is what's going to help me understand, you know, the whole sepsis thing, is to put that in perspective. It was going to help me, especially if I'm not feeling well, or if I'm having, like you said, the underlying issues. But it's good to know, because I never knew about sepsis until, you know, a couple of seminars that, you know, that you have given, and is very helpful. And now a lot of my friends know about it. So I'm really, you know, happy that it's in the community now, and people will be aware and be educated about it, because it's very helpful. I never even knew about it until Whoopi Goldberg had it. And that's when I started hearing more about it. But thank you so much. And the seminar is very insightful, and I appreciate it.
Well, thank you. I'm very happy to hear that. And the one thing that we really want to also stress is that our emergency departments continue to be safe and available for all patients seeking medical attention for urgent health concerns, whether it's COVID-19 related, sepsis related, or not. I know that there's a lot of people that are in the community now that, even though they have sepsis, or they've, as you indicated, they've heard about it before, but they're just not feeling safe, or they don't feel like they can come to the emergency room to seek treatment. But we want to just stress that it's safe and necessary to seek medical treatment at an emergency facility. This is not the time to wait and sit at home when you're not feeling well or you're actually experiencing a medical emergency. Our emergency rooms, again, are safe. And if you're feeling sick or unwell, you should seek medical treatment. Okay, I just wanted to stress that last point. And with that, I guess we'll conclude if no one has any other questions or concerns.